Every day we wake up, floss, and brush our teeth. And at night, we do it again. This is the norm for you and us, but this is not the norm for many. Some communities around the world can't afford regular preventative care, and they lack access to quality health education.
Periodontal gum disease among youth is on the rise, but it's actually one of the most preventable.
In rural, economically disadvantaged areas, oral health is often overlooked.
That's why we created Smile Bright, a youth-led nonprofit organization led by students from Mission San Jose High School.
We want to help underserved children smile bright no matter their circumstance, and we're doing so through our project Smile. SMILE stands for Stimulate Awareness for Periodontal Disease Prevention, make over 300 dental hygiene kits, implement educational workshops and service events, leverage partnerships with dentists and philanthropic organizations, and expand our project to rural China and Vietnam.
We focus on two root causes of poor oral health outcomes: low oral health literacy and limited access to preventative care. According to recent data in the United States, nearly 9 out of 10 adults have faced tooth decay at some point, and 46% neglect preventative dental care mainly due to cost, making affordability a major barrier for many.
But the effect actually began early in life, as over 50% of children aged 6 to 9 have cavities in their primary teeth. Children from low-income families are twice as likely as to suffer from cavities, emphasizing socioeconomic disparities.
With these problems in mind, we created a clear and measurable SMART goal.
Within 1 year, we aim to educate over 300 underserved children globally, mobilize over 200 student volunteers, and distribute hundreds of dental hygiene kits through workshops, service events, and international programs.
To maximize our educational impact, we made sure that all our informational materials were backed with professional medical expertise. After reaching out to 6 local dental clinics, we had the opportunity to collaborate with dentists Dr. Zhou and Dr. Huyn. They helped us during the early development stages by reviewing our brochures for accuracy and providing valuable clinical insight.
We then partnered with high school clubs like Interact, a service club with international reach, and Seromed, a medical awareness club, to host service events where students earned 1 volunteer hour by folding brochures and assembling our dental kits.
After assembling over 210 complete dental kits, we launched recurring workshops at All Star Institute, a local after-school program. Through interactive lessons and demonstrations, we taught elementary students proper brushing techniques, and by instilling healthy habits at a young age, we were sparking curiosity and change.
The last stretch of our project, Smile, took place during seasonal breaks in the school year when we expanded Smile Bright beyond the United States. With support from the Franklin Education Foundation, we implemented early education programs in rural China and Vietnam during winter 2025. In both regions, we distributed dental kits and led culturally adapted workshops for children and their families, ultimately addressing inequities in oral health education where preventative care is often inaccessible or undervalued.
Although our project ultimately achieved its goals, the challenges we encountered pushed us to strengthen our leadership skills. Our first major challenge was funding, especially for such a large-scale project like Smile. But instead of scaling back, we focused on activities in our outreach department to maintain strong partnerships with the dentists.
The next challenge we faced was more logistical, as we coordinated workshops within tight after-school schedules with set lesson plans. Through effective communication and flexibility, we found time slots that worked for both our team at Smile Bright and our partner organizations.
Internationally, our work in China and Vietnam presented language barriers and cultural differences that challenged us to reevaluate, listen, and implement strategic revisions. We provided dental kits to underprivileged children while educating their families on the importance of preventative care for healthy teeth and gums. To ensure cultural competence and accessibility, we provided brochure translations in Mandarin Chinese and also Vietnamese, allowing our resources to remain relevant and respectful across global audiences.
As leaders, we used our diverse skill sets and individual strengths effectively. Multilingual members led translations and project activities in foreign countries. Creative members handled media content and design, and outreach members managed partnerships. By staying adaptable, we exceeded our original goals. We educated over 700 underserved children across the Bay Area and abroad, mobilized 250 student volunteers, and distributed approximately 720 dental hygiene kits globally.
To continue expanding Smile Bright's global impact, we are seeking $2,450 in funds to introduce programs in new countries, enhance the quality of our dental kits, and establish a youth ambassadors program empowering students to lead Smile Bright initiatives in their own communities.
Through education, access, and youth leadership, we've shown that small, intentional actions can change the course of an entire community's health. At Smile Bright, we believe every child deserves a healthy smile and the knowledge to protect it.
With your support, we'll be able to help more children, students, and families around the world smile bright.